Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about inguinal hernia. Inguinal hernia. This is the most common form of hernia. There are two types, indirect and direct. Indirect inguinal hernia, a peritoneal sac protrudes through the deep inguinal ring, passes down the inguinal canal, and may extend as far as the upper pole of the testis. The defect is congenital and is due to a persistent processus vaginalis. It is more common in males. It may appear in infancy or early adult life. In infants, there is often an associated hydrocele in undescended testis. Direct inguinal hernia. This is acquired. The defect occurs in the abdominal wall in Hazel-Bak's triangle bounded by the inguinal ligament inferiorly. The inferior epigastric artery laterally and lateral border of the rectus muscles medially. It is due to a weakness of the transversalis fascia in the posterior wall of the inguinal canal. It is often bilateral and occurs in the older patients and may be associated with obesity, cough, constipations, prostatism. A pantaloon hernia, dual hernia, or Romberg hernia, a saddlebag hernia, is defined as ipsilateral, concurrent, direct, and indirect inguinal hernias. Hernial sacs are present on both sides of the inferior epigastric vessels and separated by the posterior wall of the inguinal canal brought down by the direct hernia. Symptoms and signs: often none. Occasionally, aching or dragging sensations in the groin. Some patients relate the development of the hernia to an episode of the straining or lifting. Some patients can push the hernia back. A painful tense tender lump that will not reduce indicates incipient strangulations until proved otherwise. Examinations of hernia. Examine the patient standing. A hernia that descends into the scrotum is likely to be indirect. A diffuse bulge medially over the canal is likely to be a direct. Locate the pubic tubercle. If the hernia is above and medial to this, it is inguinal hernia. If it is below and lateral, it is a femoral hernia. Test for a cough impulse. Lay the patient down and reduce the hernia. Apply pressure over the deep inguinal ring, 1 cm above the midpoint of the inguinal ligament. Ask the patient to cough. If the hernia appears medial to the point of pressure, it is likely to be direct. No hernia appears, release the pressure and again get the patients to cough. If it appears, it is likely to be indirect. Invagination test. For smaller hernia, it is possible to distinguish between the direct and indirect by invaginating the scrotum with the little finger into the inguinal canal. Get the patient to cough. If the hernia is indirect, the impulse hits the tip of the finger. If direct, it hits the pulp. Treatment. Uncomplicated hernia. Elective herniotomy means extensions of the SAC in children. Herniotomy and hernioropy means repair or the defect in the adults. Obstructed and strangulated hernia. This requires emergency surgery, with resections of bowel if necessary, followed by a surgical repair. Methods of repair of inguinal hernia. There are 3 accepted methods of repair of inguinal hernia. First, Lichtenstein repair. This is a tension-free mesh repair using a polypropylene mesh. Second is the Schultes repair. This is a double-breasted repair of the transversalis fascia followed by a suturing of the conjoined inguinal tendon to the inguinal ligament with no absorbable sutures. Third is laparoscopically. This may be by an extraperitoneal or NICE guidelines recommend this technique for a bilateral or recurrent inguinal hernia. Trusses may be used if surgery is contraindicated. A spring-loaded pad is applied to detect after the hernia has been reduced. The patient should apply it after lying down and reducing the hernia. They are uncomfortable and unhygienic. Indications for a truss are rare. Complications. Recurrence may occur but should be less than 2%. After complications include infections, iliolingual nerve entrapment, and testicular ischemia. Testicular ischemia is rare after initial repair but occurs with a higher incidence after a repair of recurrent hernia.